I made this video how to get your COVID-19 vaccine appointment or shot, what you need to do every day, because every day they post different places and where it's available. So you have to go either early in the morning or late at night and go to CVS's website, which is cvs.com, immunizations COVID-19 vaccine. Then you go and you select your state as you see on that chart on the right. You do the same if you're going to Walgreens. Either early in the morning or late at night, go to walgreens.com, immunizations COVID-19 vaccine, and sign on to see if it's available in your area. If it is, jump on it immediately. Don't hesitate. They're going to ask you various questions. They're going to ask you about your insurance coverage. They're going to ask if you have Medicare, and then they're going to want your Medicare number. Don't be afraid to give it because you are dealing with a safe site. Now, on the day of the vaccine, what you need to remember is you will need a confirmation that you will get a confirmation date. You will receive a vaccine text message on your phone saying, we're confirming your COVID-19 vaccine appointment. Manage your appointments. You will be given a blue link on your text to click on so that you could print out the appointment or just that you have it open. On the day of your appointment, you will be asked to provide insurance cards, that you have face covering, and a copy of your appointment and your driver's license. Now, since when you applied, you gave them all your insurance information, they're going to ask that. They're going to ask to see your driver's license to verify it's you. Now, this is what the appointment actually looks like. These are appointment details of my situation on February 25th at 5:30. I went to Newburgh, New York, and my second dose will be in March 18th. And the second dose will be at 1:45 on March 18th. And on the day of appointment, please arrive early enough to check in before your scheduled appointment. Arriving late for your appointment may result in an extended wait time. Bring your ID and insurance card, voucher, or other coverage. Don't forget a face mask covering. Wearing it throughout your visit is required. When you arrive, please check in at the pharmacy area inside the store or follow the signs for the COVID-19 vaccine. CVS tips for vaccine shots. Wearing short-sleeve shirts make getting a shot easier and faster. If you must wear long sleeves, dress in layers with the short sleeves underneath. Review the patient fact sheet about the specific vaccine you're receiving. What do you do if you feel sick or have COVID-19 symptoms? Contact your healthcare providers immediately. If your provider recommends it, get tested for COVID-19, please cancel your appointment. Don't come to the pharmacy. Schedule a new appointment when you're well. After your vaccine, be prepared to stay 15 or 30 minutes after the COVID-19 vaccination so you can be observed for side effects. You might get dizzy, you might get nauseous. Luckily, I had none of that. If you experience side effects from your COVID-19 vaccine dose, you may find some guidance at coronavirus vaccine prevention tips and frequently asked questions. The CDC, has created a way for you to report how you feel about your COVID-19 vaccination through a smartphone-based tool that uses text messages and web surveys to check in with you. So you get there, be early, have your case covering, make sure you have it on your phone. If you don't have a phone, I don't know what they do for you, but at least print it out that you have an appointment. When you get there, they're going to have a sheet of all the people that are supposed to get there at that particular time. So be early, wear your face covering, and bring your proof of insurance. Now, common questions. How much does the COVID vaccine cost? The federal government is providing the vaccine free of charge to people living in the United States. However, your vaccination provider may bill your insurance company, Medicaid or Medicare, for an administration fee. But the pharmacy will ask for your Medicare card and insurance information. How many COVID-19 vaccines will be needed? With the COVID-19 mRNA vaccines, you will need 2 shots to get the most protection. The time between your first and second shot depends on which vaccine you receive. You should get your second shot as close to the recommended 3-week or 1-month interval as possible. When will the vaccine be available to you? Because the supply of COVID-19 vaccine in the United States is currently limited, CDC is providing recommendations to federal, state, and local governments on who should be vaccinated first. CDC's recommendations are based on those of the Advisory Committee on Immunization Practices, an independent panel of medical and public health experts. Each state has its own plan for deciding which groups of people will be vaccinated first. You can contact your state health department for more information on its plan for COVID-19 vaccination. The goal is for everyone to be able to receive it easily to get a COVID-19 vaccination as soon as large quantities of vaccines are available. As the vaccine supply increases, more groups will be added to receive vaccination. And here in New York State, senior citizens like myself are the first to get it after the first responders and people in nurses, the nursing home population. It was a pretty well-run operation. They were prepared at CVS where I went, and I'm sure it's the same at Walgreens. Everything runs pretty smoothly if you come prepared. So make sure your phone is on, make sure you have your mask, make sure you have your insurance information, and make sure you have your identification. Confused about Medicare? What's Part A? What's Part B? What's Part D? What's Part C? What are the Medicare penalties? What are the Medicare deadlines? Go to our free daily Medicare educational webinar and get all your answers to what you need to know. Go to seniorhealthcorp.com and register to get on the webinar. See you there. Go to Senior Health Corp to get all the information you need about Medicare, Medicaid, health insurance of all kinds, because my name is Bill Vargas and I'm an independent Medicare agent serving the health needs of seniors and veterans just like you. So go to seniorhealthcorp.com or call us at 1-888-200-2040. See you on the next video. Thanks. Bye-bye.